Increasing age, obesity and underlying health conditions all raise the risk of surgery. Add to that list the day of the week. A new study shows that patients having operations on a Friday are significantly more likely to die than those having surgery on a Monday. And it's because they're recovering at the weekend when there are fewer staff and resources in hospitals.
The consultants are available and do come in, but there are other issues such as access to support services like scans, people that take blood, physiotherapy, critical care outreach services that can put in lines into very sick patients if it's difficult to get intravenous access.
The results show that if patients have their operation on a Monday, 55 in every 10,000 will die within the next 30 days. But if surgery is on a Friday, that rises to 82 deaths for every 10,000 operations. That means the risk of death increases by 44% over the week. An NHS whistleblower blamed pressure to reduce waiting lists from the Department of Health.
The Department of Health were criticising NHS trusts for not having fully utilised theatres, i.e. If there was space on a Friday afternoon, trusts were told, well, why haven't you used it for an operation? Why aren't you clearing the waiting list? So I think as a result, you can see that trusts were using much more of their operating time, and it would appear from the data that some extra risk was put into that process, and patients clearly have come to harm.
The Department of Health says shorter waiting lists are good for patients, but targets shouldn't put them at risk. Patient groups say surgery is generally very safe, and those due for a Friday operation shouldn't panic.
If they are worried, they should definitely speak to their doctor or their health team at the hospital. And one of the questions I'd ask them is how robust, how adequate are the aftercare facilities in that particular hospital? Can they guarantee that they'll be monitored and supervised by an experienced doctor, a consultant, who'd be able to recognise and deal with complications if they do arise?
NHS England is currently looking at ways of increasing weekend working so patients get good care whenever they need it. Thomas Moore, Sky News.